Ciprofloxacin is an antibiotic that may be given to you to treat bacterial infections. This antibiotic belongs to a class called fluoroquinolates. It can be used to treat a number of infections. You may be given this medication to treat urinary tract infections and respiratory tract infections like pneumonia. However, it can also be used for treating various other bacterial infections. In this video, let's discuss the important key facts about this medication. Now, let's see how to take this medication. Ciprofloxacin is available as tablets in two different forms. It is available as immediate-release tablets as well as extended-release tablets. These extended-release tablets release the medication very slowly, and they can be used once a day. This medication is also available in other dosage forms. The dose of ciprofloxacin is variable, and it is based on the patient's conditions as well as the purpose of use. Normally, for urinary tract infections, it can be given at a dose of 250 to 500 milligrams 2 times a day for 7 to 14 days. It can also be used at a dose range of 500 to 750 milligrams for treating other infections like respiratory tract infections or bone infections, and it can be given for up to 14 days, or in a few cases, it can be given for up to 8 weeks. The dosage and duration, as well as frequency, depend on the type of infection, but here immediate-release tablets are given 2 times a day, whereas extended-release tablets are given once a day. Now let's see the important precautions of ciprofloxacin. You should use ciprofloxacin at the dose and duration recommended to you. Overuse of this medication can affect your neurons. It can produce a condition called peripheral neuropathy. It is one of the neuronal disorders that produces abnormal sensations due to damage to the neurons. You may have a burning sensation, pinning sensation, numbness, and stinging sensation. If you have elevated levels of glucose or pre-existing diabetes, this peripheral neuropathy may be more pronounced. This neuropathy is irreversible in nature, so if you develop any abnormal sensations like pinning and stinging, it may indicate the development of neuropathy, and caution should be taken while using ciprofloxacin. With long-term use, ciprofloxacin can affect your tendons. It can increase the inflammation at the tendons, particularly, it can affect the Achilles tendon, resulting in pain at the ankles. It can also affect the tendons at the rotator cuff, thumb, and biceps. These side effects are observed when this ciprofloxacin is used at higher doses. Few risk factors can increase the incidence of tendon rupture. People with age greater than 60 years may have increased risk of tendon rupture, and those people who are using corticosteroids like prednisolone and hydrocortisone may also have increased risk of tendon rupture because these drugs can weaken the bones. Similarly, any previous history of bone fractures may also increase the tendon rupture with use of ciprofloxacin. If you have kidney dysfunction, this side effect may be more pronounced. Autoimmune disorders like rheumatoid arthritis can affect your bones and joints. Therefore, tendon rupture may be more pronounced. Any excessive physical activity may also increase the risk. All these things should be considered before using ciprofloxacin for longer periods. This tendon rupture may be observed after several months of use. In a few people with any risk factors, it may develop within a few days. So if you observe any joint pain and inflammation at the joints, use of ciprofloxacin may be limited or may be avoided. With the use of ciprofloxacin, you may also have diarrhea and abdominal pain. Normally, it is well controlled. However, some may experience severe diarrhea. Generally, this diarrhea can be produced by the development of one of the conditions CDAD or Clostridium difficile-associated diarrhea. This is one of the pathological microorganisms that is going to be developed in the gut wall due to the use of ciprofloxacin. Normally, the gut flora can fight against this Clostridium difficile, but whenever this ciprofloxacin is used, this protective gut flora is inhibited, resulting in the increased development of Clostridium difficile infection. This may result in severe diarrhea and abdominal pain, and it can also induce nausea and vomiting. Other side effects of ciprofloxacin are mainly observed on the CNS. It can produce headaches, dizziness, and skin rashes. However, many of these side effects are mild, and the diarrhea can be controlled by taking probiotics along with ciprofloxacin. This medication can also affect your muscles and their contraction. It can reduce your muscle contraction, and it can produce muscle weakness and muscle paralysis. However, this action is more important in people with any muscle disorders like myasthenia gravis. So in such people, use of ciprofloxacin should be avoided. You may need to stop or avoid using ciprofloxacin in a few conditions. If you observe palpitations, fast heartbeats, or a prolongation of the QT interval in the ECG, it may indicate a serious action of ciprofloxacin on the heart. So if you observe these symptoms, use of ciprofloxacin may be avoided because all these are the fatal side effects. If you observe any blood in stools, that may indicate severe diarrhea along with infection. Again, in such conditions, this drug may be avoided, and probiotics should be used. Similarly, if you observe any severe muscle pain and swelling of joints, this drug may be carefully used. Development of abnormal sensations like stinging and pricking for longer periods may indicate the development of peripheral neuropathy, which develops the numbness in the pupil. This peripheral neuropathy may become irreversible with continuous use of ciprofloxacin. So if you develop these symptoms, it is better to replace this medication with other alternative agents. Use of ciprofloxacin can make you feel dizzy and lightheaded. It can produce a state of confusion, and people may also have hallucinations. Similarly, it can also produce some insomnia, and a lack of sleep and a state of anxiety and nervousness can be produced. Even though ciprofloxacin is safe under the normal dose at higher doses, it can increase the risk of seizures since this drug lowers the threshold potential for the induction of seizures. So for the people with any pre-existing seizures or any history of epilepsy, ciprofloxacin should be used carefully. Even under toxic doses, ciprofloxacin can induce sudden seizures. That's all about ciprofloxacin. Thanks for watching this video, and if you find any interesting facts on this medication, please share them in the comment box below. Please do subscribe and hit the like button. I will come with another interesting video in the next week. Until then, have a nice time, take care, and goodbye.